This week on Healthy Living, the World Health Organization warns of an ongoing global outbreak of cholera. Aid relief agencies intensify efforts to contain a cholera outbreak in Sudan. And is boiling water always safe to drink? We'll have the answer in true or false. Plus, Bill Gates speaks out on the global malnutrition crisis in an exclusive interview with VOA. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linord Moudou. Thank you for joining us for another edition of Healthy Living. Get this, death from cholera soared by 71% in 2023 compared to the previous year. So far this year, more than 342,000 cases and 2,400 deaths of the diarrheal disease have been recorded in 22 countries, according to the World Health Organization. WHO says conflict, climate change, and safe water and sanitation, poverty and displacement have contributed to the rise of cholera infections. A cholera outbreak is affecting Sudan, particularly in the states of Kassala, Gedaref, and River Nile. Sudan's Ministry of Health has recorded more than 5,000 cases of cholera infections and at least 191 deaths. Doctors Without Borders has set up several centers to treat patients in an effort to stem the spiraling out of control infections. Here is more with Blanche Sanou, narrated by Anthony Labruto.
Sudan has been hit by torrential rains for several weeks, leading to the displacement of thousands of people. There has been an increase in cases of diarrheal diseases, especially among children. The state of Kassala has been especially impacted by cholera, and authorities have appealed to the international community for urgent and immediate assistance.
The current status for cholera since now, we cannot say that today the situation is under control. We still have a lot of challenges from everywhere. And currently in the CTC now, we have 261 patients. And still now we continue to receive new admission.
The World Health Organization has stated that more than 455,000 additional doses of vaccines will be sent to Sudan to help the country tackle the cholera epidemic.
Today we receive many patients come in critical state. And for us to save those patients, it becomes very difficult because they come with gasping, and then to save those patients, it's very difficult.
Cholera is an acute diarrheal infection caused by the consumption of contaminated food or water. The disease causes diarrhea, severe hydration, and can lead to death within hours.
So today, there is many reasons. The first one is access of water. There is no access of water in terms of quality and quantity of sanitation. Inside the IDPs camp, refugees camp, and also in the community.
The war has led the country to the brink of famine, and humanitarian organizations denounce insecurity and bureaucratic measures that hinder the delivery of aid, a situation made worse by floods and poor road conditions.
Desiree Bouyana-Misati is in charge of the National Health Promotion Communication Program of the Congolese Ministry of Health in North Kivu Province. He discusses some of the challenges as well as advances in the fight against cholera.
Cholera is a disease that causes the body to lose fluids frequently, causing dehydration. This dehydration leads to death. The treatment mainly consists of products that aim to rehydrate the body. Additionally, some antibiotics can be added to the treatment protocol and are highly effective against Vibrio bacteria. Regarding the water supply system in displaced persons camps, both governments and partners provide support, such as large trucks to deliver water to the displaced camps. However, during a recent assessment, we found that the water supplied to IDPs is still insufficient. Sometimes days go by without the displaced people receiving water. We have found that this lack of water is a root cause of some cholera cases that arise in the camps. We had organized some vaccination campaigns, but even the vaccine manufacturers have determined that to be effective, Vaccinations must be accompanied by other steps that I mentioned. Hygiene measures such as clean water and sanitation and the availability of water in households, as well as environmental hygiene. This includes waste disposal, treatment, and monitoring of water far from the population, along with household hygiene like cleaning utensils and all the materials and tools used in households. This reinforces the effectiveness of vaccines, even though these vaccines, according to the manufacturers, have an efficacy rate of only 60%. There is still a remaining 40% that depends on the hygiene measures we must implement.
It is often said that boiling water is a sufficient way to kill all microbes. Is it true or false? Medical experts say boiling water is one method of water disinfection. Boiling water can help eliminate certain contaminants like viruses, pathogenic bacteria, protozoa, and more because they cannot survive boiling temperatures. Bacteria begin to die at 149 degrees Fahrenheit, which is 65 degrees Celsius, but boiling water for at least 1 minute is a good precaution. However, this does not guarantee safe water, as boiling does not address issues such as toxic chemicals, heavy metals, radioactive materials, and more. Boiled water is generally considered safe to drink, but should not be used for extended periods of time if possible. More than 400 million children the world over are not getting the nutrients they need to grow and thrive. According to the WHO, nearly half of deaths among children under 5 are linked to undernutrition. The Bill and Melinda Gates Foundation has released the 2024 Goalkeepers Report, which emphasizes the devastating burden of malnutrition and explores innovations that can help tackle the crisis. In an exclusive interview, I spoke with Bill Gates, co-chair of the Bill and Melinda Gates Foundation, who explains why malnutrition is a crisis that needs more attention and resources.
Well, we've always known that malnutrition is an underlying cause, but it's been as we have an effort we call CHAMPS, where we actually look at thousands of deaths and see, okay, what are the factors involved? And that's the data that showed that it's a higher percentage than you would expect. It's over half of those deaths if the kid hadn't been malnourished. So when most people hear the word malnutrition, they'll think of situations where there's a food shortage, an extreme food shortage, like a famine. And although that does happen and it's tragic, that's not the main case for malnutrition. Malnutrition's happening where some kid doesn't get the right diet, gets some diarrheal episode, and their gut, including the microbiome part of their gut, is inflamed, and so they're not able to take advantage of the food. And so, we studied with our African scientists, we looked at twins where one twin would do well and one wouldn't, and then, took samples to understand, okay, exactly what's going on and how do you stop that? And so it's partly micronutrients that are missing, things like iron, zinc, vitamin A. It's partly a lack of protein, where there you should think milk and eggs are the main source. And so we have a variety of ways of intervening, some of which are very inexpensive. Of course, a critical period for nutrition, people might be surprised, is during pregnancy. That is, before you're born, your mother's nutrition affects your entire life, how your brain and body develops. And so one of the exciting new interventions is giving pregnant mothers additional vitamins. We've always traditionally given them 2, iron and folic acid, but by adding 4 others, which is only a few dollars per pregnancy, we see that the health of the mother and the health of the baby are substantially improved. And so what we're asking for, which yes, does show a sense of optimism because the world is very distracted and, you know, getting the debt relief and getting these aid levels back to where they were, you know, as we're raising money for the Child Nutrition Fund, for Gavi that funds the vaccines, for Global Fund, we're finding it more difficult. We're not able to raise even the same amount as we raised in the past. And to me, that's tragic. It's a misallocation of resources. Resources are short, but these are cases where you're saving lives for a few thousand per life saved. And particularly through nutrition, you're creating the human resource, which is the future of not just the individuals, but these countries as well. It's you know, those young, innovative Africans that'll allow these economies over time to reach, you know, middle income or, you know, even higher levels. And so, you know, the fact that we have these nutrition problems, but now the research understandings that, you know, we're the biggest funder of the work in that area. You know, we're trying to give people a sense of hope, but it is a time where the attention to these issues is not as high as it was, or I think it deserves to be.
The Nigerian authorities and the CDC have adopted rapid testing for mpox at Nigeria's key entry points as part of heightened surveillance for the detection of the virus. Timothy Obiezu reports from Abuja on some of the emergency measures Nigerian authorities and the CDC are taking against the spread of the new mpox variant.
At Nigeria's National Reference Laboratory in Abuja, health workers are speeding up sample testing for mpox. The measure follows the designation of the disease by the Africa CDC last week as a public health emergency. Jide Idris, Director General of the Nigerian CDC, says up until now this year, the organization has recorded only 39 cases of mpox and no mpox-related deaths, but he warned it's important to stay vigilant.
It's because of people coming from outside, travelers from outside, especially those areas where these diseases are occurred. We need to be sure that we do not we trace just to curtail spread of especially the one into the country.
Africa's top public health agency declared an mpox emergency after reporting nearly 3,000 confirmed cases of the virus, with over 500 deaths in 13 African countries this year. Disease epidemiologist and chair of the Africa CDC's Emergency Consultative Group, Salim Abdul Karim, warns that more needs to be done to test for the virus.
The evidence we have on the number of cases, the number of deaths, they are just the tip of the iceberg. And the reason is that mpox is largely a mild condition. We have limited surveillance. We have limited capacity to do the testing that's required.
But analysts say stigma and misinformation could significantly hamper the country's response efforts against mpox.
There should be some unconventional medium of sharing this warning and information. It can get to the grassroots so that you can be able to prevent it. But just going on radios and just television is not enough.
In 2020, the WHO declared mpox an international health emergency after cases were reported in over 70 countries. While Nigeria braces for a possible outbreak, public health analysts say more proactive measures and international cooperation are needed to eliminate the threat. Timothy Obiezu, VOA News, Abuja, Nigeria.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linord Moudou. Until next time, stay well and strive to make every day a healthy day.